So, hello everyone, this is Dr. Raghuteja, laser and laparoscopic surgeon, ONUS Robotic Hospital. So, today we are going to discuss about perianal abscess. What is perianal abscess? How does this happen? What are the complications of neglecting this abscess? What are the symptoms, signs, and how to investigate this abscess? How to treat this condition? So, today we are going to discuss A to Z about perianal abscess. So, there are different types of abscess which can happen in the perianal region. So, these are the different types of abscess. So, perianal abscess is one. Intersphincteric abscess. What is intersphincteric abscess? There will be a sphincter here. Two types of sphincter, external sphincter and internal sphincter. So, if the abscess happen between the sphincters, it is called as intersphincteric abscess. Now, this is perianal abscess. Anywhere just beside the anal ring, if the abscess happens, that is called as perianal abscess. So, there are different types of perianal abscess. One is intersphincteric, ischiorectal abscess, supralevator abscess. So, this is a muscle called levator muscle. So, if the abscess happen above that levator muscle, we call it as supralevator abscess. So, now what happens, the most important thing about ischiorectal abscess, what happens with ischiorectal abscess? Ischiorectal abscess is the abscess that happens in the fossa of ischiorectal region. There will be a fossa called ischiorectal fossa. If the abscess occurs in that fossa, we call it as ischiorectal abscess. Now the features of this abscess is patient will have severe pain, but he or she will not feel severe type of swelling, any type of swelling in the perianal region. Why? The entire abscess or pus will be collected inside this fossa. So there will be lot more pus present in the abscess or fossa, but the swelling, the visible swelling is much minimal when compared to the abscess present actually. That is the most important characteristic feature of ischiorectal abscess. Now, coming to perianal abscess, people neglect these perianal abscesses. They treat on their own self, like they will go to medical shop, take their antibiotics, start the antibiotics, or they will scratch the abscess with the finger, and or they will use those instruments, their own instruments, whatever instruments available in the home or office, they'll just use that instrument and take out that abscess. But will that work? This is the thing. This is the most important thing we need to ask for ourselves, because the most important complication of neglected abscess is fistula formation. So what is fistula? Body tries to take that, body always tries to help ourselves. So it tries to help. How does that help? Like, whenever there is a pus formation inside the abscess or body, what does body try? It will help the body to come out as a, because the pus will create infection, the pus will cause sepsis. So to avoid that, body helps by creating a opening called external opening. Through that opening the pus comes out. This is called as fistula. So whenever there is incomplete drainage of abscess, there will be high chances of fistula in ano formation. So to avoid that complication, we need to address the perianal abscess as early as possible. If needed, definitely they need to undergo a procedure called incision and drainage. So through incision and drainage, the pus will come out, we will drain the pus out, and we will clean the wound properly with betadine peroxide, H2O2, hydrogen peroxide, and saline. Then the wound will become clean, then the wound will become healthier, then the chances of fistula in ano formation is very, very low. So this is how perianal abscess has to be treated. But how we need to investigate perianal abscess? There are different types of scans, like ultrasound scan and MRI scan. So basically we'll start with ultrasound scan. In that, we will come to know how much collection is present in that fossa or abscess. Then we will decide whether to go ahead with antibiotics or incision and drainage. Most of the time the procedure is I and D. We have to cut that abscess and we need to drain that pus. Then the wound will become healthier. This is the most important thing one need to understand. Then after that we will do proper dressings. If the wound is large, there are different types of methods to heal that wound. Vac therapy machines are available. There are negative suction machines. So this is about perianal abscess. So if someone is suffering from perianal abscess, I am Dr. Raghuteja, laser and laparoscopic surgeon, available at ONUS Robotic Hospital. So you can reach me out at any time. If you have this type of problem like perianal abscess, ischiorectal abscess, fistula in ano, abscess in fistula, all those procedures can be done with laser or without laser with minimal complications. Thank you.